For the first time in Georgia, a robot has been used in a prostate cancer operation. The procedure was done at St. Joseph's Hospital in North Atlanta.
Channel 2's Dr. Randy Martin is here to show us how it went.
I don't want any kind of surgery, but when somebody says we're going to have a robot operate on you, you'd say, whoa, but there are tremendous advantages. And every day, prostate cancer claims the lives of 80 American men. Now, if it's found early, it can be treated. And one treatment is obviously surgery to remove the cancerous prostate. And while there have been many improvements in the type of surgery that not only take care of the cancer but also maintains a man's sexual function, I think one of the most dramatic developments is having this operation performed by a robot.
And my PSA came back a little bit high.
51-year-old Gary Eads was recently diagnosed with prostate cancer, and he, like many men, was surprised because he had no symptoms and no family history of the disease.
And we decided that surgery was going to be my best option.
Instead of the traditional surgery, where doctors make open incisions of various sizes, Mr. Eads decided to have an operation that involved his doctor using robotic technology. With this technique, small keyhole-sized incisions are used, and the surgical instruments, which in this case have tiny cameras on them, are attached to the robotic arms. The surgeon, Dr. Scott Miller, controls the robot from a nearby console.
We place our fingers inside here, and by moving these around, the little wrist instruments will duplicate the movement of my wrist.
Using the robot, Dr. Miller not only has great control, but he is able to magnify what he sees in the body, giving him a better three-dimensional view of certain areas.
Well, the advantages are tremendous. It's such a precise procedure. The visualization is far superior. The blood loss is far less.
While the use of the robotic technique for prostate cancer is new and needs to be compared with some of the other surgical approaches, it appears that patients can recover much faster than with the traditional open surgery. In fact, Mr. Eads spent one night in the hospital and is expected to resume normal activities in about 2 weeks.
Long term, he should have an excellent prognosis, both from the cancer cure rate, sexual function, urinary control, and most importantly, he should not have any chronic pain.
It's wild stuff, and then we're glad for Mr. Eads, and congratulations, Dr. Miller. Now, I really want you to remember this, that you do need to have prostate screening sometime between the age of 40 and 50, and that entails the blood test called the PSA. It can save your life. Now, it's also known that by eating the proper diet, I'm going to sound like a broken record here, low in fat so that you're not overweight, and you exercise, you can decrease your risk of cancer. And one other interesting thing, a diet rich in tomatoes and tomato products can be very beneficial in helping to prevent prostate cancer. But this robotic surgery is really dramatic. I mean, gives precision and visualization. One downside, that cost about $1 million to put one of those in, but I personally think that this is the way a lot of it will be done in the future.